you so much to everyone for joining us today. We're going to take just a few minutes to let everybody get in on the session, and then we will get started. Thank you so much for joining us for this installment of the Root Cause Coalition's How To webinar series. My name is Rachel Carlson, and I am the membership coordinator here at the Root Cause Coalition. Before we get started with our presentation, I want to go over a few logistical items for this webinar. Attendees will be in listen-only mode for the duration of the presentation. This presentation is being recorded and will be available to view at rootcausecoalition.org/webinars later this week. Our panelists will be taking audience questions at the end of the presentation. If you have a question during the presentation, please type your question pane into the question pane box located at the right side of your screen. We are so excited to have our esteemed panelists join us to share their expertise on how to use data for community engagement and improving well-being. At this time, I would like to pass it off to our presenters from the City Health Dashboard, the National League of Cities, and the City of Rancho Cucamonga.
Hi, Rachel. Thanks so much. This is Becky Ofran from NYU City Health Dashboard. I'll just be kicking us off to talk about community engagement and using data. Next. So I'm joined by Laura McDaniel from the National League of Cities and Hope Villard from Healthy Rancho Cucamonga. Next slide. So the goals and the description were in the webinar that you signed up for, but we're really just going to be talking about how to use data in different ways, really across sectors in cities, and to use that data to further community engagement strategies. So we'll hear a little bit from NLC and myself about data and collaborative efforts across cities, and then we'll focus on what Rancho Cucamonga has been doing. Next. Go ahead, Laura.
Thanks, Becky, and thank you to the Root Cause Coalition for having me here today. My name is Laura McDaniel, and I'm the Program Manager of Health and Wellness here at the National League of Cities. I'm thrilled to be here today with our partners at the City Health Dashboard and from the City of Rancho Cucamonga to talk about how to use data more effectively for civic engagement efforts. Before we get started today, I want to give you some background on the National League of Cities and share with you why this work is so important to us. The National League of Cities is the voice of America's cities, towns, and villages, and we represent more than 200 million people across the country. Next, please. Our mission is to strengthen local leadership, influence federal policy, and drive innovative solutions. Next, please. On the Health and Wellness team, we're housed within the Institute for Youth Education and Families that helps municipal leaders take action on behalf of children, youth, and families in their communities. On the Health and Wellness team, we help local leaders address factors affecting how well we live and how long we live. Next, please. As part of that work, we lead the Cities of Opportunity initiative to look across various issues such as economic opportunity, housing, and city planning and design, and their intersections with health. We believe cities of opportunity are places where all people can reach their full potential and live productive, fulfilling, and healthy lives. Next, please. Cities of Opportunity is a learning community for city leaders taking a comprehensive approach to health and well-being in their cities. We created Cities of Opportunity, or COO as we call it here, in recognition of the fact that many interrelated factors that affect people's health, mental, physical, and spiritual, converge in cities. COO focuses on 3 issue areas. These include economic opportunity, housing, city planning and design. And we provide city leaders with capacity building in 6 core capacities. These include data, equity and race, financing, multi-sector collaboration, sustainability, and civic or community engagement. Community engagement and data are central components of the work that we do with city leaders, and I'm so pleased to be here today with Becky and Hope so that they can tell you more about how to practically use data for community engagement. From there, I'll turn it back over to Becky at City Health Dashboard.
Great. So thanks so much, Laura. National League of Cities has really been a solid partner of ours as we've developed and expanded the dashboard. And our goal with the City Health Dashboard, if you haven't used it, is really to help cities and leaders leverage the power of local data to improve the health of residents. So today I'll talk about how you can use dashboard data at the city and neighborhood level to help communities improve health and well-being. Next slide. So most data on health and drivers of health are not organized at the city or neighborhood level, but rather at the county, state, or national level. And the City Health Dashboard really changed that for the largest 500 U.S. cities. It's a free website, cityhealthdashboard.com, that shows over 35 measures of health, the drivers of health, and health equity for the largest 500 cities in the U.S. And that includes cities down to a population of 66,000, which is actually quite small cities. So sometimes when we say the 500 largest cities, many places don't realize they actually fall into that group. And it covers over a quarter of the U.S. population. Next slide. So the tool allows you to view important health-related measures at the city level and at the neighborhood or census tract level for about 2/3 of the measures. And where available, we also provide the data by demographic breakdown, such as gender or race and ethnicity. The dashboard takes health determinants out of the realm of just the health department to city planners, the buildings department, the police department, so you can all collaborate together on issues that are important to you. We democratize the data, highlighting gaps and disparities to ensure that everyone has the same opportunity to live a healthy life. The dashboard is geared primarily towards city leaders, collective impact and cross-sector work groups, and community advocates. But the data is also available and rigorous enough for academic researchers, journalists, and students. Next slide. So the dashboard features measures at the city and, like I said, where possible, the neighborhood level. So we see here life expectancy in Columbus, Ohio, where across these 3 census tracts within a distance of less than 2 miles, the life expectancy ranges from 60 to 80 to 68 years. You can also look at how your city is doing compared to other peer cities on important health issues and really compare apples to apples. Next slide. We access local data from national data sets, so you really can compare across cities, and we update the data regularly. All of these measures are measured the same way for each of the cities. So if you're looking at diabetes rates in Columbus, it's measured the same way as diabetes rates in Jersey City. We also have worked with our partners to select meaningful measures that are really actionable at the city level, and that's a crucial piece to empowering local leaders who know their communities best. So you can see here we cover more traditional measures of healthcare and behavior like uninsured rates, smoking and physical inactivity, and health outcomes like breast cancer deaths, diabetes rates, and life expectancy. But we've also focused on socioeconomic factors and the built environment, such as walkability and air pollution, children in poverty, education measures, and crime, to really give the full context of the community. All of these measures together help to give a fuller picture of well-being in a city. In fact, we can analyze which measures users of the dashboard look at most frequently, and besides life expectancy, obesity, and diabetes, the most popular measures are poverty and income inequality, issues that contribute to health as much or more than visits to the doctor. Next slide. So when you start on the website, it really is meant to just help you dive right into a city. So next slide. This will be just a quick demo of what you see. So I started with Kalamazoo, Michigan, because we do some work with them. And this shows you all the measures again, and you can just select what measure you're interested in or start with an overview. And I'm going to start with children in poverty. Next slide. So just to kind of give you an overview of how we contextualize the data, so everything is shown on a scale in blue. Lower and lighter, well, lighter colors represent better outcomes, and in this case, actually we're looking at uninsured, lower values are better. The gold bar is the value for Kalamazoo, Michigan. The little blue triangle at 12.9 is the average of all of the cities on the dashboard, and the green check mark above Kalamazoo's value of 10.2 shows you that they are in fact doing better than the average of all of the cities on the dashboard. Next slide. Then as you scroll down the page, you can get into the fun stuff, which is really the map, and for values that are available at the neighborhood or census tract level, that's when you get to see the real differences within the city. And what we see is that value of 10 or so for Kalamazoo actually is a range from 4.2% to 17.9% for an uninsured rate across the city. And you can see how that varies by census tract. Next slide. Diving down even further, for a number of our measures, we also have it broken down by race and ethnicity. And here you really start to see even more variation. To give context, we also tell you what percent of the city population that race or ethnicity makes up. So for example, I'm looking at Asian residents at the top. 15.8% of them in the city are uninsured, but they make up 2.2% of the total city population. And you can see how that varies for the different race and ethnicities. And it really provides a lot of additional context on top of really seeing how it varies across the census tracts or neighborhoods as well. Next slide. We also have a feature where you can look at how two measures kind of compare to each other at the same time. So here we're still looking at uninsured in Kalamazoo in the shades of blue. And I've added children in poverty on top of that, which is the pink or red dots. And again, for both of these, lighter colors represent better outcomes, and for both of them, those are lower values as well. And what's helpful about this is, we try to make sure that we don't overstate the relationship between two variables, but it lets you see the patterns and how two measures might be moving together or not in neighborhoods across the city. Next slide. So what do you do with all of this new information? We don't want to just make data accessible on the dashboard. We want you to be able to take action on it. So we have this Take Action Center, which features a curated list of policies and programs from different partners like County Health Rankings, Change Lab Solutions, Local Housing Solutions, NYU Furman Center, and many more. We also feature other resources that can help answer questions like, how can I find funding and partners for my project? How can I monitor and evaluate the effectiveness of this program? And we're also happy to add resources here. So if you know of something particularly useful, please send it to us. Next slide. Finally, using local data can really help you understand the community context and target resources in really practical ways. So whether you're planning for a Census 2020 outreach or doing other community survey work, you have to fully grasp the factors that affect people's lived experience. So now I'll pass it over to Hope to hear about how Rancho Cucamonga is doing just that and putting data into action.
Great, thank you so much. As Becky mentioned, my name is Hope Velarde and I am with the City of Rancho Cucamonga, a Health ERC, and I'm here to share how we are using data to drive our community engagement. Next slide. So before I get into that, I wanted to provide some background information on who we are. So we are Health ERC. We launched in 2008 to address rising chronic diseases and health conditions with a broader lens than simply just eating right and exercising. We heard loud and clear from our community that health and quality of life was a priority. Next slide. Through a strategic planning process, we were able to reach 1 in 5 residents, where these residents actually identified the 8 priorities that encompass health, not just in the traditional way, but making sure it truly touches on every aspect of health in the lives of our community. So these priorities go beyond the traditional definition of health and weave a holistic view on improving quality of life for residents. So these priorities include anything from healthy eating, active living, to mental health, to disaster resiliency, clean environment, economic development, education and family support, which all align to advance health equity. Next slide. So at the core of Health ERC is the strength of the city-community partnership that has been developed. This chart, I wanted to briefly share the structure of Health ERC. So we have external and internal structures weaved throughout the tree org chart. To maintain our comprehensive approach to health, we are housed in the city manager's office, although it is a citywide initiative made up of multi-departmental representatives from each department. So the governance structure also fosters meaningful participation by all segments of the community. So you can see from the bottom to the top and from the top back down to the bottom, community plays a key role throughout Health ERC. They are really what guides and what helps us guide and prioritize our health priorities when it comes to developing and implementing comprehensive policies, systems, and built environmental strategies to improve the community health and wellness. Next slide. So one of the guiding principles in creating a healthy city is to optimize community resources through collaborative partnerships among public agencies, private sectors, community-based organizations, and of course, our local residents. So Health ERC joins partners with diverse expertise to share decision-making authority and address complex community problems centered around the common goal of improving health and wellness for all. Engaging the community is a critical strategy in addressing health disparities, especially among our disadvantaged communities. And community participation enables the city to interact with and understand our needs, our community needs, and reflect these in the delivery of services. Next slide. So to ensure that some of our most vulnerable populations had a seat at the table, Health ERC developed 2 community resident empowerment groups, the Community Champions and Youth Leaders. Both groups were designed to equip residents with the skills they need to meaningfully participate in the policymaking process and build their capacity to change their environments and promote health. Both groups have been instrumental in the adoption of the city farmers market policies, community garden ordinances, our e-cigarette ordinances, and they've also helped shape language on what should be included in zoning laws, and they've spoken at council and advocated for several policies and programs to better the health of our community. So the success and sustainability of both of these groups have really served as a best practice and for us for what community engagement should look like within our city. Next slide. So the city wanted to formalize these best practices through a policy. So it was with our work as a pilot city for NLC Cities of Opportunity that we were able to develop this policy and connect with leaders and experts throughout the nation to begin this process. Next slide. So the community engagement policy with a health equity framework identifies strategies to ensure equitable and inclusive engagement as the foundation of how the city does business. So at the core of this community engagement policy is a framework that provides the city with systematic approaches to developing partnerships with Rancho Cucamonga's diverse communities, which will ensure that all community ideas and perspectives are included in shaping public policies, practices, projects, and services. especially those that are historically excluded, underrepresented, or under-resourced, because it is oftentimes these populations who are left out of the decision-making process and who are the oftentimes most affected by the decisions being made. Next slide. So how do we ensure the most vulnerable have a seat at the table? So at Rancho Cucamonga, we are using data. We have leaned a lot on the City Health Dashboard. We also have a great team, a GIS team here. So we are really looking at data to really drive our strategies and our efforts. For this example here, we're looking at life expectancy and socioeconomic metrics, including children in poverty, high school graduation, racial ethnic diversity, and income inequality. All of these socioeconomic metrics have provided us an essential snapshot of what our community looks like. The visualizations on the site have helped us better engage underrepresented groups and tailor our outreach efforts to make sure that they're not overlooked like they can be with more traditional means of data collection. So we took a look at the dashboard's compare metrics to better understand the relationship between life expectancy and children in poverty. So based on the data, we can see that our southwest area has a lower life expectancy and more children in poverty. So this is crucial information as we do outreach to our community to ensure we specifically reach these vulnerable populations. Because as I mentioned before, at the end of the day, they are likely the population in our city that needs our services the most. And not having their voice be a part of the decision-making process would be a missed opportunity that could negatively affect their health and well-being. We've also found that having this local data available is really powerful for our community members. We've shared the dashboard tool with our external community partners and our steering committee groups, the community champions and youth leaders that I previously mentioned, and it really gets them thinking, why does my census tract have a shorter life expectancy? How can I as a community member get involved to help change this narrative? So simply having the facts, and I think being able to present this in a meaningful and digestible way helps empower the community to be involved, share their voices, and make a difference. And I think this map in particular, as I mentioned, the Southwest Cucamonga area has a shorter life expectancy and more children in poverty. We've actually engaged our community champions with this information, and they've helped us identify some strategies in making sure that we reach this specific population as well as all of our other vulnerable populations, just in terms of, you know, what incentives should we provide, what places of gathering should we do our outreach to ensure that they are being reached. Next slide. Similarly, we took a look at racial ethnic diversity and income inequality. So again, historically speaking, our Southwest area here is being highlighted because they are predominantly Hispanic and they display a wider gap in income inequality compared to other parts of the city. So again, it's really looking at this data at the local level and deciphering how can we meet these pockets of neighborhoods where they're at. What are the community centers or places of gathering? In some areas, it's a school or it's a place of worship, and I think this data has really helped us shape our strategies to reach them where they're at. Next slide. So we're lucky to have access to a GIS team here and GIS software. So we're also looking at secondary data to help us identify kind of what our community looks like. So here we were able to map some of the top languages in our city. So this map shows the population that speaks API languages only between the ages of 18 and 65, and it overlays it with poverty levels. So the darker and bigger the circles, the higher poverty levels and greater the population that only speaks API languages. And so kind of that central piece of our city, like we now know because of this data and being able to compare it, that we need to do something. Our outreach strategies needs to be different and unique to be able to reach the API language the API language only population with a greater poverty level compared to some of our northwest regions of the city. Next slide, please. So similarly, this map shows the population that speaks Spanish only in comparison with poverty levels. So again, the darker and bigger the circles, the higher poverty levels and greater the population that only speaks Spanish. So again, you can see our southwest area here is highlighted with our Spanish-speaking only population compared with higher levels of poverty. So these maps, along with the City Health Dashboard data, really demonstrate the need for our translated surveys and outreach specialists when doing outreach in these specific neighborhoods. And I will say having the data to back this need up has been really crucial in terms of allocating funding in our budget to make sure that we have translation services, or making sure that we have bilingual staff, or stipends to potentially pay bilingual volunteers to help us with our outreach. The data has really driven a lot of these efforts and has made it successful for us to get some of these resources to do these targeted outreach strategies. Next slide. So using the data, we've piloted some of these outreach techniques and strategies with our most recent engagement effort. Over the last several months, we've been engaging our community with our Healthy RC's Quality of Life survey. So this survey will help us assess the needs of our community and create targeted strategies to better serve our city to make it the healthiest it can be. So the results from this survey are crucial in identifying where to allocate future resources and funding and what types of programs should be developed. So it was really instrumental for us that we reach everyone within our city, cast a wide net, and really focus in on some of our vulnerable populations. So looking at the data that I previously shared, we knew we had to translate our surveys. There was no way around it. So we've translated the survey in Mandarin and Spanish. As I mentioned, we were able to get some bilingual staff and volunteers and to help us with this outreach effort. And we've also leaned on a lot of our partners that have connections with these two populations. So we've leaned on nonprofits and specific stakeholders, such as our we have an API Happy 50 Plus nonprofit here that has great ties with the API community. We've leaned on a lot of our faith-based organizations that have a wide reach with our Hispanic-speaking population. So we're starting to pilot some of these techniques of looking at data, using data, and creating strategies to do our outreach. Next slide. So this one looks at the uninsured by race using the dashboard data. So for this one, we've had several meaningful partnerships with our hospitals and insurance providers. So this dashboard data really demonstrates, what our uninsured population looks like. So this was interesting because we have specific strategies of engagement through our providers whose members were on their listserv. They were doing outreach for us by sending out, messages and surveys through their network provider listserv. But having this data was a really good reminder that we need to incorporate multiple strategies to reach the diverse groups in our city that are not insured. This also allowed us to kind of brainstorm some successful outreach ideas to reach the uninsured population. So one example that we have is hosting a health fair where they can access preventative services in our neighborhood or in their neighborhood to incentivize them to participate in our surveys, conversations, and activities. And so it's really just a good reminder to paint us a picture of what our community looks like and how we can keep that in mind when it comes to creating these outreach techniques. Next slide. Traditionally, we've done a lot of outreach in our parks. Although they've been relatively successful, knowing the data and having it again at the local level and broken down by demographics, We've had to have discussions on, new locations of outreach. Where can we hold events and outreach activities so we can truly meet the people where they're at? Because we can see here that from the data, right, that we don't have a lot of truly our community. I mean, there's a lower percent or a higher percentage that lack access to parks. So as part of the development of our policy, we are identifying locations to reach our diverse populations. So again, whether it's a park, a church, or a community center, we want to be intentional. So eventually, we are working with our team here to create a mapping tool for our city that identifies some of these gathering spaces and key stakeholders in the community, along with their contact information that is relevant to the neighborhood and population we are trying to reach, so that our outreach is streamlined throughout the city, and that everyone, whether you're in our city manager Health ERC department or in public works or whatever it may be, if you're looking to do engagement, we want to be able to have a tool that kind of outlines where you can hold your engagement depending on what population and what neighborhood you're trying to reach, and then who are the key contacts, our stakeholders for that area. Next slide. So similar to park access, the same idea goes for access to healthy foods. Traditionally, we've done outreach at different grocery stores, but again, are we truly meeting people where they're at? So this data helped us identify meaningful incentives to offer to the community to participate. We found that gift cards to grocery stores, particularly for some of these subgroups who lack access to healthy foods, and then again looking at the map of our city and knowing from our data where our grocery stores are and which specific neighborhoods we're trying to target, that providing incentives to gift cards to these grocery stores have been really influential in increasing participation when trying to reach certain populations. And I know this sounds kind of probably basic, but it actually kind of changed some of our it was a game changer for our outreach efforts in terms of reaching some of these subpopulations. So even something as simple as looking at the data to identify what should be provided as an incentive has been really helpful in our strategies. Next slide. I wanted to share with you one last thought that we are doing here. So we're using data to make sure our outreach strategies are working. So meaning, does our outreach represent our community? So we're happy to say, at least for the quality of life survey, this is what these two graphs represent, that it does. So we compared our survey respondent zip codes to our city's population by zip code using ACS secondary data, and you can see that it's pretty close, which goes to show that we are being intentional with our outreach efforts. Looking at the two models, we could potentially target our outreach efforts to reach more of a population in zip code 92336, so that they have more representation, and so that our survey respondents match what our community makeup looks like. So in this case, I would go back to the dashboard or other data sets to see, okay, what is it about 92336 that could help me reach this group? So that's just one example of how we're closing the loop with data. We're not just using it to inform our initial outreach strategies, but we're using it to make sure that our intentional efforts are being met with our survey respondents matching what our community demographics and population look like. Next slide. So I just wanted to end that local data shows us the neighborhoods that may require different approaches to data collection in order to better address these health determinants and outcomes as a community. So whether that means providing the survey in a different language or providing different incentives to fit the needs of the community, we're using data to tailor our approaches to meet our community where they're at. And with that, I would welcome any questions.
So now we are going to go into the question and answer section of our presentation. So I'll give a few minutes for any participants to type their questions into the question box located on your screen, and we will start reading them out in just a minute. So the first question we have from one of our participants asks about, based on all this data, what improvements have you started seeing in health outcomes in Rancho Cucamonga?
So we're still in the process of analyzing the data from the quality of life survey. That should be coming in the next couple months. But I will say, just from a prior evaluation that was also done kind of around the same time, or a prior evaluation that was done a few years ago actually, where some of these strategies were implemented. I mean, we've been able to just reach a wider net of our population, and then with that, our results, I think, are more representative of our community. So in terms of health outcomes, at least from the first evaluation, which was actually done in 2015, we've seen decreased rates in obesity, hypertension, heart disease, and diabetes as well. So we have been able to see outcomes, and I think for this go around, we're hoping that we can continue to see these health outcomes, but also we just want to know that we just want to be able to target, now that we have this local data, what specific neighborhoods can we make improvements? What specific census tract has, asthma rates increase versus another one. So yeah, we're looking forward to that data, but we have yet to analyze it.
Another one of our participants asks about what advice, she talks about how it can take time to build trust with community members, to engage with data collection and supporting decision making. So what advice do you have for outside research organizations who are partnering with local organizations to do this work? And what are some best practices that any of you have learned for building trust and bringing in outside organizations to support you?
Yeah, so that's a big one. I think, there's several components too, and I think also it just depends on your, historically speaking, how long you've been present in the community, or what your past engagement efforts have been like. But I know for Health ERC, so I mean, it was a process. Like I mentioned, we started in 2008, and I think there are several things, but some of the things that come to mind that kind of kept the people coming back was really that relationship building. So I know some of the staff members who were here back when Health ERC first started. It was really building that trust by showing up. So not only just making the space for the community members to come, but helping them feel empowered as well. But then on a personal note, I think kind of having those relationships, like for example, our staff member who works directly with the community champions, has really just been consistent with them. I think it's consistency and follow-up. A lot of the times when we go out to engage the community, you know, there's a piece, we do make sure to do a follow-up. So we engaged you on this process, and then it's not just a one and done, thanks for your input, but it's really taking them throughout the process, which I think encourages the decision-making process and encourages their feedback. And then when you can show results and outcomes from their engagement, I think that's when most of the buy-in happens. So a small example, our community champions, they did a sidewalk audit. They did a photo voice project where they took pictures of their infrastructure in their neighborhoods, and it started out as like a little project just to get them aware of kind of how their neighborhood is and what it could be. And then throughout the process, we submitted it for a grant, and they helped us with that grant by including their testimonials. And then we actually got that grant and did sidewalk improvements in their neighborhood. So I think it's just the consistency and the follow-up, and then I think even the small wins need to be celebrated so that they know that their voice really does matter.
Hi, and this is Laura from NLC. I completely agree with everything that Hope said, and the only thing I would add would be that you know, one thing particularly with an outside organization coming in, you know, it's important to remember your role coming into a community. So as much as you can work with community members to identify, you know, what are the things that they need to focus on, and what you need to, you know, what data you need to collect, rather than going in and saying, okay, we've identified these problems in your community, but really working with them and taking them through the process, just as Hope said, that will, you know, go a long way toward building trust within the community.
On a similar note, another participant asks if you encountered any local organizations that were skeptical or resistant to their involvement in this initiative, with a very broad view of determinants of health.
Off the top of my head, we haven't had much opposition, and I think that has something to do with the community collaborative part of it too, because and I think we kind of touched on this in the previous question, but I think having that community piece gives us validity, because then we're not just a government entity, we're actually a community collaborative. So we actually haven't had, we've been lucky, we've been very well received, and we continue to gain new partners every month. I think we have consistently over 75 partners who show up, and I think again it's that collective voice that gives us validity and kind of credibility in the things that we do. So sorry, I don't know if that helps or not.
And this is Becky, just chiming in. And sometimes this is where data can be really helpful, because it kind of puts everybody on the same page, and instead of somebody just coming in, you know, with an idea of an issue that's going on, you can say, you know, look at what we're seeing, look at what we're measuring.
Thank you so much. Another one of our participants asks Hope if you can talk a little bit about what some of the funding and the cost was for implementing this initiative in Rancho Cucamonga, and what either the return on investment has been so far, or how that ROI is going to be measured.
Sure. So just to clarify, the Health ERC initiative as a whole, or the outreach or the policy initiative? Community engagement?
They don't, I guess a little bit of both.
Sure. So for Health ERC, actually, can you repeat the question?
Yeah, no problem. The question is asking if you can talk a bit about the cost of implementing the initiative in RC, and what the return on investment has been so far, or how will that return on investment be measured?
Sure. So just speaking broadly for Health ERC, and I can't give you exact numbers, but I can probably follow up with you if I get your contact information. But just speaking generally, I think when Health ERC first started, everything was grant funded. So we had to fight for every dollar and make a case every year or every time the grant cycle was up for why we're relevant, why we're important. And I think over the years, just through some of the wins we've been able to show with whether it's through an actual program or policy or like infrastructure improvement, or even just the relationships we've been able to create with our community, we've actually been able to be fully funded by the city now. So I think just in terms of return for investment, like I mentioned, we've done our evaluation in 2015, and we were able to show decreases in chronic diseases and you know, some improvements in community connections and you know, areas around education and family support. And I'd be happy to share our evaluation and some of our results from that as well. But I think as we continue, like I mentioned, with the quality of life survey moving forward, we're hoping to continue to show these improvements. And then in terms of the quality of, or I'm sorry, the policy, we actually were able to, we secured a grant through our county to kind of work with a contractor or consultant to help us develop this policy. The grant was for about, I believe is $25,000. So that's kind of where the policy piece is coming from, and or how much that piece cost. In terms of the return for investment on that, we're working on measurements with our consultant to kind of to gauge how successful this policy will be, whether that's you know, how successful it's been implemented within the departments or how the community is taking to it. But we haven't decided what those metrics yet are. But by March, when we have to finish the policy, we'll have all of those metrics for you.
And I think this is a question from one of our participants that's a little more broad for all of our presenters. But how might this tool, the City Health Dashboard, and the work that has been done in RC, how would that maybe work in unincorporated areas?
So for the City Health Dashboard, the cities that are on the dashboard are census incorporated places, I think.
Census designated places.
Census designated places. So we can only work with the data from ACS and our other data sources when it's defined at the municipal city limits. So so I don't think we can have unincorporated locations on the dashboard. But there might be some data that you can access separately, and you can always see our data sources and go right to those sources and see if you can get it for your locations.
And a couple of participants have asked about accessing the City Health Dashboard and its availability and how they can connect with that online. So can you talk just a tiny bit about that, Becky?
Sure. So it's just www.cityhealthdashboard.com. As long as you have an internet connection, you can access the tool. And maybe you could, I can't share with all of the participants, but maybe you could just share that link in the chat, but it's completely accessible there. We update the data a couple of times a year based on when the underlying data sources are updated, so that you're accessing the most recent data available. And just a few months ago, we added past years of data, so you can see how the data changes from year to year. And we added a couple of other features. All the data is downloadable. and accessible through an API as well. So you can go onto the site and download the data for your state or for all of the cities.
Great, thank you so much. And I just shared that in the chat section in the webinar, but it'll also be posted on our website with all the other follow-up material and will be available if you reach out to me or any of our presenters. One other question we have from one of our participants asks if you, Hope, can give some examples of how logistically you involved the two community empowerment groups and what sort of did that look like operationally?
Sure. In terms of our outreach, well, two pieces. They were very critical actually, and are very critical in the development of our policy. So just to kind of go through that piece, our policy is being developed currently, and I think I mentioned before it's going to be passed in March. That's our deadline. But our two empowerment groups have really given us so they meet on a bi-weekly basis. So we see them regularly, and I think throughout this development of the policy, they've been instrumental in helping us identify strategies specific for youth, strategies specific for the Spanish-speaking, generally senior population, for the community champions. We've held focus groups with both groups on kind of getting to the root of engagement, of what strategies work, what are their barriers. So all of their input has been, will be reflected in the policy. In terms of actually doing outreach, so they've been really great. They've actually been hitting the pavement with us as staff and volunteers. The community champions have done, outreach at their local churches. They've actually even had, they've done outreach at family parties and community gatherings that they have in their neighborhoods. So they are truly the boots on the ground with us, and they do a great job of representing the city. And honestly, they're happy to do it. I think they're invested in what the city is doing and what we're doing as a collaborative, and they want to be out in the community. So it's really helpful when you have a group like the champions and the youth leaders that you can lean on to kind of reach their specific populations. For the youth leaders, they've been really instrumental in getting us into the schools. So I didn't talk about this in the webinar, but we have a specific outreach effort with the teens called our Teen Quality of Life Survey, and we've been doing outreach and surveying at our 4 high schools here, and our youth leaders have been really great about getting the message out to their clubs, actually doing surveys in their classes, and then again just being out at community events with us. So they've been really influential in all of this.
Yeah, and on that note, another one of our participants actually asks about, with the community champions and the youth leaders, who was responsible for the selection and assessment of those candidates who became the community champions and the youth leaders?
Sure. So our champions is actually anyone can join. It's an open group. So we have about 12 to 15 like consistent members since its inception. So that's an open group, and that's usually by word of mouth. And we have promotional items too, but usually word of mouth. And in that neighborhood, we've gotten our champions from particularly the Southwest area. For youth leaders, it is a competitive process. We have about 25, or we have 25 this year, which is a large group, and we actually have to turn folks away. So it's a competitive process. We have a panel consisting of one of our Health ERC staff, along with two previous youth leaders or youth leaders who have been in the program to be on the interview panel. So there's a short kind of application that the interested youth leaders have to submit, and then they do an in-person panel interview.
Another one of our participants asks about the questions on the community connections, or the community connections questions on the survey, and what is the source of some of those questions, and if you can maybe share an example of one of them or so.
Sure. So, sorry, I have to apologize. I don't have the survey in front of me, but I will say when the survey was developed a few years back, we worked with an evaluation contract group. So they actually helped develop some of these questions. I'd be happy to send out the survey if people want to view that for reference. But I'm sorry, I don't have it in front of me, so I can't speak to the questions. It's a long survey. It's about 50 or so questions, which we know that's a barrier for people to take, but that's when you're trying to capture all the information, it's hard to take questions out. But yeah, I'd be happy to share it if that helps.
Great. And so I think we have time for just one more question to finish us off today. What is the greatest takeaway you think, or any of our presenters think, for those looking to replicate what work was done in RC?
I think the biggest takeaway and kind of where our successes have come from is really, again, the community needing the data piece. We've done a good job kind of building those relationships over the past 11, 12 years. But I think having the data now to back it up, and not just city data, local level data. I can't thank the dashboard enough, and everyone on the webinar, because it's just been really, really helpful to help paint our picture of what our community looks like. That's kind of why we started doing our own data so that we could have local level data at the census tract level. But I think having the dashboard now as a tool, and then again meeting with the community aspect and having those relationships has really been instrumental and helping us move our work forward, and helping us continue to showcase that Healthy RC is thriving, and our communities are thriving because of it.
Wonderful. Thank you so much to our presenters. I am putting their contact information back on the screen for anybody who wants to take it down. I want to thanks again so much to our panelists and to all of our participants for joining us today. As a reminder, this session has been recorded and will be available for viewing at rootcausecoalition.org/webinars later this week, as well as a copy of the slides will be posted there as well. Additionally, if any participant is interested in presenting on a future webinar, feel free to please contact me, Rachel Carlson, at rcarlson@rootcausecoalition.org. Again, thank you so much to everyone for attending today. Have a great rest of your day and rest of your week.